Hi everyone, this is Sara Hadid from Teach with Sara channel, and in today's video I will go through 7 ways to overcome depression without medication. To overcome depression, it helps you to know the facts. Depression is a medical condition and not laziness or temporary response to normal grief or discouragement. Symptoms of depression: a major depressive episode is defined as experiencing 5 or more of the following symptoms every day or most days for 2 weeks or more: depressed or irritable mood, sleep problems, change in interest or low motivation, changes in appetite, significantly worse concentration, significantly low energy or change in self-care, and the last one, excessive guilt or unrealistically low self-image. It's important to remember that not everyone who is depressed is suicidal. You can still seek help even if you have not demonstrated any specific suicidal or self-harm behaviors, or even if your symptoms are not as severe or persistent as the symptoms noted above. Okay, I'm feeling depressed, so now what? Now that you know the symptoms of depression, some positive coping skills can be useful for you. All of the following techniques are supported by scientific research and medication prescribers, and these skills are frequently recommended as important parts of treatment even for patients who continue to take antidepressant medications. Actually, I recommend doing many, if not all, of the following coping skills and technique at least once a day. When experiencing depression, it's important to know you probably won't be motivated to do any of them at first because depression is frequently self-motivation. In other words, know that's not normal to feel unmotivated until you are halfway done. Find small ways to be a service to others. To be of service to others. Find personal meaning by serving something larger than yourself. Remember, service does not have to be big to count. Consider this: success, like happiness, cannot be pursued. It must ensure, as the unintended side effect of one's personal dedication to a cause greater than oneself. Find workable goals that give you a sense of accomplishment. Most people feel guilty when talking about goals because they set unreasonable and unworkable goals. A goal is workable if it is something you can control, I mean, it does not depend on others, manageable, i.e., not overwhelming. It should be realistic for you, not for someone else. It should be measurable. You know whether or not it's done or getting done. If something goes wrong with your goal, adapt what can I learn from this. Attitude versus a judgmental. This is why I'm horrible attitude. Also, be careful when comparing your progress with others. We usually compare our biggest weakness with another person's biggest strength. This is unfair and usually not accurate anyhow. Pleasant events. Schedule pleasant activities or events. Don't wait for yourself to be in the mood. For example, give yourself permission for 30 minutes at least vacation or schedule a healthy hobby every day. Just remember to do these activities with the right attitude. Also practice gratitude. Take time to notice what went well today, not just what went wrong. Consider keeping a gratitude journal. Know that being grateful for your blessings does not mean you have to discount your problems. Engagement. Stay in the present. What does that mean? This practice is sometimes called mindfulness. As best you can during activities, try not to be in your head with self-judgment. You may not be able to turn off the self-judgment, but you can notice it. And bring yourself gently back to the present. Just research shows that people with the higher self-compassion also have higher self-worth or self-confidence. You have to do exercises and eat right too. Doing moderate exercise about 5 times a week, like 30 minutes a pop, can dramatically help your mood. Moderate exercise is a level of activity where it's difficult to sing from your diaphragm while doing it. Also pay attention to how the type of food or drink you are eating influences your mood. You don't have to do fad diet, but anyone will be depressed if they frequently banks on carbs, junk food, and energy drinks. Remember the virtue of moderation. Focus on people who lift you up. Interact frequently with others that bring you up, not people that bring you down. While it's okay to have some alone time, find a balance and don't isolate yourself or the depression will linger. Try to keep a regular sleep schedule. Keep a balance with not too little and with not too much sleep. Staying up late one night and then sleeping and excessively and next day is surefire way to feed depression. Also, don't try to solve problems late at night when your brain is half asleep. As you practice these coping skills, know that you are on the path to overcoming depression. In contrast, depression tends to linger when patients make up a reason why they cannot do these things. No matter what medication you are taking, doing several of these activities every day, especially when you don't feel like it, is vital to the treatment of depression. These positive coping skills may take time and practice, but if we don't take the time to be well now, the periods of unwellness may be forced upon us later. And thank you for listening.